psychyogi.org. Münchauser Syndrome. A syndrome wherein individuals afflicted attempt to make themselves ill or pretend to be ill in order to gain attention and sympathy from others. Münchauser Syndrome is a fictitious disorder, and it was named after Baron Münchausen, who was a German aristocrat who was famous for his tales of exploits. Other names for this disorder include hospital addiction syndrome and thick chart syndrome. Münchausen syndrome by proxy. Münchausen syndrome by proxy is a variation of Münchausen syndrome, where the individual afflicted causes illnesses to other people, often to those in their care, particularly children. It doesn't have to be that they cause the illness to their people in their care. It may be that they tell other people that that person is ill, i.e. taking the child to the hospital claiming that they are suffering from X symptoms when they're not. This way the person gets the attention and sympathy they want without getting hurt themselves. It's also called factitious illness by proxy. Some of the reasons for Münchausen syndrome include, firstly, that the underlying reasons are typically not known to the person. Most people don't even know they have Münchausen syndrome. One of the reasons is people want to acquire the sick role. Now, this is where they want to be in the care of other people because they are sick themselves. So if you're in hospital, you will be treated by doctors and nurses. And that's what people with Münchausen syndrome want. They want that attention. Another possible reason is childhood trauma. Now, this is from the psychodynamic perspective. And there isn't a whole lot of evidence that is perfect in showing that this really does cause psychological disorders later in life. Personality disorders are another reason, so there are at least 3 which have reasons why Münchausen syndrome may occur. One of them is borderline personality disorder. This is where a person struggles to regulate their feelings and often swings between positive and negative views of others. There's also antisocial personality disorder. A person may take pleasure in manipulating and deceiving doctors, giving them a sense of power and control. And there's also narcissistic personality disorder. This is where a person often swings between seeing themselves as special and feeling the opposite, that they're worthless. So it's most common with females aged between 20 and 40, particularly females who have a working knowledge of some of the illnesses, so you do find this a lot with nurses. It's also quite common with unmarried white males aged between 30 and 50, although it is more common overall with females. However, it can start at any age. It doesn't have to just be, between 20 and 40, 30 and 50. But really it's mainly adults who suffer from this disorder. Now that may be because adults really have the control over having an illness. So let's look at some of the real life examples. There was a patient who injected herself with fecal matter, which then gave her septicemia. One of the common things that patients do is interfere with their wounds, so they may try and rip their wounds apart or put things in them like pens. Some patients put blood into their urine to make it look like something is wrong, as in they cut themselves, let the blood go into their urine, often a sample, to make it look like they have symptoms of some illness, even though they've just created that. One patient, in fact, had 38 stomach operations to find something that she claimed was in there but wasn't, and she kept claiming she had a pain in her stomach, and eventually they stopped giving her stomach operations. One of the most famous cases is Beverly Outlet, also known as the Angel of Death. Now, she was a British serial killer and she was a nurse who suffered from, it's believed, Münchausen syndrome by proxy. She killed 4 children in her care. One of them was found to have an air bubble in their bloodstream, and an air bubble in your bloodstream kills you, and it's typically from not properly injecting someone. I believe she also injected people with morphine as well. She also attempted to murder 3 other children and cause serious harm to 6 others. The treatment for Münchauser Syndrome can be quite difficult because if a person doesn't know they have it, it becomes very hard to explain to them that they have it. Once the person understands, then it becomes easier to treat them, and typically cognitive behavioural therapy is used, although in the past it was things like psychoanalytic treatments. So cognitive behavioural therapy is when you try to manipulate a person's pattern of thought, which then can prevent them from suffering from the symptoms of certain disorders. If you've enjoyed this Psych Yogi video, why not subscribe to keep up with all the latest videos?